Dr. Binoy John, Senior Consultant Interventional Cardiologist.
I'm Dr. Binoy John, Senior Consultant Interventional Cardiologist, former Director Head of Department of New York Hospital, and former Senior Consultant with Madras Medical Mission, Frontier Lifeline, Apollo Hospital, and Narayana. I'm here now visiting as a consultant in Smart Vision. Today I'll be talking to you about diabetes and how it causes multi-organ damage and how you can take steps to prevent it and keep it under good control. Diabetes is a disease which affects almost like 250 million people all over the world, and by the year 2030 it is predicted that it will affect almost like 350 million people. Multi-organ damage, if detected early, is irreversible, and if it is detected late, can produce irreversible changes in these organs and damage it. Diabetes affects the heart, it can affect the nerves, it can affect the kidneys, and can also affect the eyes. The eye part is usually neglected, and if not controlled properly, what can happen is it can produce blindness. So prevention carries a major role in detecting diabetes, preventing diabetes, and the control of it. How can you detect diabetes? Any person who is above the age of 45 years, if he has no risk factor, if the patient has got risk factors like family history of diabetes, or if he is overweight, then he has to undergo periodic checkup even earlier. By periodic checkup means visit the doctor, get your blood pressure, pulse rate, and all the body checked up, and also get blood sugars checked, kidney functions checked. Nerve conduction studies are important because the nerves can get damaged by uncontrolled diabetes, and get an eye checkup also done. And for the heart, what happens is uncontrolled diabetes can produce blocks inside the arteries. It is not only the arteries in the heart that can get blocked, but almost all the arteries in the body can get blocked. Cholesterol, everything has to be checked. And for the heart, you have to get an ECG done and echo test done, because diabetes, if uncontrolled, can produce heart failure also, because the heart pumping efficiency can come down. And also a treadmill has to be done every 6 months. Treadmill test, what they do is they will connect the ECG and make you run on the treadmill, and any blocks, if it is significant, can be detected on the treadmill. And pertaining to the nerves, you can do nerve conduction studies which will show the amount of damage in the nerves, and also a periodic checkup of the eyes also have to be done. This is to prevent diabetic retinopathy and blindness. This is regarding the periodic checkup. Now there is a condition called pre-diabetes, that is before diabetes there is a condition where the blood sugars are in the borderline level. So if the patient is found to be in the pre-diabetic level also, there are certain guidelines by which you can delay the onset of diabetes or even prevent it. So whether the patient is in the pre-diabetic stage or in the diabetic stage, the most important thing is to keep the blood sugars under control. So how can this be done? One is by having a healthy diet. A healthy diet means a diet which is rich in vegetables, green leafy vegetables, and moderation of fruits, and avoiding all these aerated drinks and anything which contains unnecessary sugars. And another most important thing is, don't have a sedentary lifestyle. You should be very active. 150 minutes of exercise every week is recommended. That is moderate exercise. Moderate exercise means 30 to 40 minutes of brisk walking, or something which is equivalent to that. So exercising regularly is very important, and try to maintain a normal body mass index. The body mass index is a calculation that is derived from the height and weight. The normal body mass index is 18.5 to 24.9, and when it is more than 25, the person is said to be overweight, and if it is more than 30, the patient is said to be obese. So the most important thing is to be active, cut down on your weight, and try to maintain an ideal body weight. So with a good diet, periodic exercise, and regular checkups, diabetes can be prevented, and if it is there, it can be kept under good control. And the most important thing is to prevent target organ damage, which is irreversible.